Hello and welcome to everyone listening to this interview. My name is Lina Badr. I'm the FIP lead for Workforce Transformation and Development at the International Pharmaceutical Federation. I'm also the lead for the FIP Transforming Vaccination program. Today's event or interview is part of that program. The Transforming Vaccination Globally, Regionally and Nationally program of this year focuses on accelerating equity, access and sustainability through policy development and implementation. And I'm very pleased to be hosting today's interview to discuss LifeCourse Vaccination and how that impacts access to vaccination and widening equity as well. I'm really pleased to be interviewing Lois. Hi, Lois. Thank you for joining. I just want to start with introducing you, Lois, before we dive into our questions. I'm really excited about our chat today. Lois Privor-Dumm is Senior Advisor, Policy, Advocacy and Communications Director at Adult Vaccines at the International Vaccines Access Center, Johns Hopkins Bloomberg School of Public Health. She's a global expert on equitable vaccination and access across the life course. Her research focuses on determinants of vaccine policy and uptake, and she has worked with global stakeholders and countries to advocate for and implement new vaccine policy and programs. She partners with the Baltimore City Health Department, partners, institutions, and local faith leaders to guide conversations to build trust and increase vaccination rates. Currently, she leads a COVID-19 vaccine education effort for a peer ambassador program. She is a member of the Community Vax Coalition and Convince, designed to engage communities, promote health literacy, and address vaccine hesitancy, and member of the Maryland Department of Health COVID-19 Vaccine Technical Advisory Group and Vaccine Equity Task Force. She joined Hopkins in 2005 and has worked in more than 70 countries, helping to accelerate vaccine access. She holds a Master's of International Business Studies from University of South Carolina and executive certificates in human-centered design and innovation and business communication from Johns Hopkins Carey School of Business. Lois, welcome. Thank you.
Thank you so much. I'm looking forward to talking to you.
Me too, and I'm really humbled to be interviewing someone with such a huge list of achievements, especially with COVID-19 and you are at the forefront of the work of COVID-19.
Yes, it's been quite a change and quite a challenge, and I think there's a lot of what I'm hoping to be good things that will come out of this, because it's bringing a lot of issues to the forefront. And I look at it as an opportunity to improve health of people all around the world.
Absolutely, and I think with COVID has really put a spotlight on what vaccines equity really means and how important that is for all of us to recover from this pandemic. So I'm really excited to talk to you about this today with a spin on LifeCourse approach to health. So Lois, I just want to understand from your point of view and your expertise and experience, what does LifeCourse approach to health really mean? Why is it important?
Well, the LifeCourse approach recognizes that health is shaped by a variety of factors and is not influenced solely by the present moment, but a series of events throughout a person's life or throughout the community's life. It is the recognition that health is influenced by environmental, social, and economic factors. And this is important because what happens at various stages of life can have a very big impact later on in life, and also have impact on others at their current stage in life. So all of these things are intertwined, and it's important to consider how interrelated various factors are and how they can influence not only your own health, but the health of others.
And how does this fit with LifeCourse vaccination? So what does that mean? We know what LifeCourse approach to health is, but what about LifeCourse vaccination?
Right. LifeCourse vaccination takes the same concept and recognizes that we are not only vaccinating to protect ourselves at a particular stage in life, but that vaccines protect us for later in life, or protect us or protect others who can't be protected at their particular point in lives. For example, when an older older baby or older adult or others are vaccinated, they're protecting those that are too young to receive vaccines or whose immune systems are not quite as robust, so they need extra community protection. And COVID-19 is a great example of, as people age, their immune systems decline. So they do need that not only direct protection by vaccination of themselves, but they also rely on others in the community being vaccinated to reduce the burden of disease and transmission around. And that gives that extra level of protection. That will also help people with, immunocompromised situations or those that maybe don't respond to vaccines in a particular way. And the other thing is that some vaccines are given early in life because the disease is going to impact you later in life. So, like for instance, the HPV vaccine, human papillomavirus vaccine, is going to protect children from, it's going to protect people from cervical cancer later in their lives, even though at the point that they're giving it, it's not likely that they'll get the disease. Same thing with hepatitis B, that also has protection for liver cancer later in their lives.
And I think, Lois, speaking at least personally, we've gotten used to the idea of LifeCourse vaccination, mainly including routine vaccinations that start at childhood. How do you think the pandemic has changed this approach to include vaccines that prevent from communicable diseases and pandemics? Is this becoming part of the LifeCourse approach to health and vaccination discourse?
I think absolutely. And one of the things that the pandemic has done is really, as you said earlier, shined a spotlight on the need to consider the needs of people throughout their lives and at various stages of their lives, and consider, where are the risks of disease and the impact of disease later on in life. So in this particular pandemic, and other pandemics have been different, but this particular pandemic started out impacting older adults most acutely. So they were really the group that needed to be protected. So the conversation is about, how do you make sure that you can reach older adults at that stage in life when they're most vulnerable and make sure that they're protected, but also start to think about who are the people around them that influence what their outcome might be. It's things like making sure that all health workers are vaccinated, making sure that family members or those that are visiting them or coming in contact are vaccinated, and also thinking about who is spreading the disease. Because right now, we've vaccinated the older adult population. This is in the US. Obviously, it hasn't happened the same way across the world, but you can vaccinate the older adult population, and that only provides a certain level of control. There's others where the disease circulates, and we need to consider at their particular life stages, what is the purpose of vaccination, and do we need to be protecting them, and what value does that bring?
That's really, really important. And Lois, going back to LifeCourse, and we know that means the different stages of life from infancy all through to older adulthood. From your perspective, do we see age inequities across these different life stages? What are the main concerns with equity in terms of access to health and vaccinations when it comes to these different life stages?
So when it comes to age inequities, I think the first thing that is important to recognize is that inequities are often cumulative, and they're influenced by what has happened over a lifetime. So if a person, particularly at the very young ages, starts off in life with poor nutrition, or maybe is growing up in a place that, you know, has a lot of air pollution, those influences have an impact on a person's health when they grow older. And so what happens is some of those inequities as a person grows older are exacerbated. And, you know, it may be that a person is in a certain place, and because of their age, they have some challenges because your immune system is going to decline naturally. But that's affected by what also happened earlier on. So it's all the more important that we address some of those inequities that have been happening throughout a person's life, and make sure that we provide, you know, extra protection to protect people that may be considered vulnerable or may need to fight off health needs in a different type of way. The other thing is, it also becomes more important that those around that person that are more vulnerable are also doing the things that they can do to be protected, so they don't transmit disease, they don't put that person in a more vulnerable position.
I think the concept that inequities are cumulative is really quite dangerous and scary. And if we want to try and reduce them, then, you know, maybe it's too reductive to say at which point would it be most important to try and address inequities. Does it start at childhood? Is it about parenthood? Where did we begin?
And that's really a great question. And I think we have to begin at all of the stages. Obviously, in childhood, those are very, very formative years. And I think that's one of the reasons why a lot of focus has been on, you know, making sure that the first years of life of a child are as healthy as possible. So you'll see a lot of programs targeted towards the youngest people in a community. And that makes a lot of sense. But you can't just ignore that that there's issues going on throughout a person's life. And we can't just say that, okay, we're going to take care of children and, you know, worry less later on. You still need to intervene later on, because disease targets a different stage of life, and, you know, taking care of them when they're children will help make them more healthy when they get old. But for certain diseases, it won't do anything. So we do need to intervene directly at those later stages of life. And we see that with, like, influenza, for example, that you know, this is a disease that changes year after year. And, you know, every year older adults are, you know, some of the most vulnerable, along with the youngest of children. And getting a vaccine, you know, as a child is not going to protect you as an adult. So we do need to make sure that we're doing things at that later life stage.
I think that also brings us back to why LifeCourse approach to health is important, because it has to be integrated, and we can't just segment these life ages and stages separately. So I think that's really important. And Lois, I wanted to ask you then, speaking of LifeCourse approach to health, vaccination, let's talk about policy for a little bit. And where do you think policy comes in, and what are the most important policy focuses should be?
It's a great question again. And, you know, I'm a vaccine person, and I often turn to that example. And I think that it is simply actions that promote better access to primary health care. So, for instance, ensuring access to vaccines, but also other services. I think we need to remove some of the barriers to receiving vaccines and screening and other primary care services that are required for good health, requiring counseling at the time of vaccination, blood pressure screenings, things like that, I think can make a difference. And those are things that a government can influence to make sure that people are seen as individuals first, that it's not just about, coming in and ensuring that somebody gets a vaccine. The other thing that I think from a policy perspective that is really important is about use of data and requiring that providers are taking a look at the data and asking questions about, whether people are vaccinated or, whether they've had their blood pressure checked or cholesterol checked or things like that, can make a big difference because, when you start to catch disease early or see concerns early, you can intervene and that will make a big difference. There's a lot of policy changes that could be made, but I think one of the main things are thinking about removing barriers to access, so to ensure that people can go to seek care where they want to, that that they don't have to go to special facilities to be able to receive a vaccine or to seek care, that they can go to someplace close to their home. And those are things that make a difference. It also makes a difference in enabling people to go to people they trust, which in a lot of places throughout the world, it may not be that the place that they trust is a doctor in a hospital. It may not be that, they trust their, the government provider. There are other places that people go that they have more of a relationship. And if that encourages better care, that can be a good thing.
Well, speaking of trust, and I completely agree that policy change should focus on removing existing barriers, and then we can focus on the enabling part. Really, really good point. How about the role of pharmacy? And as a healthcare professional advocating for vaccinations, especially during COVID-19 and beyond, what are your thoughts on the role of pharmacy in this?
Yeah, so pharmacy has played a very, very big role. And I think, during the pandemic, there's been more of a recognition that you have to get out to more places where people go. And oftentimes pharmacists are trusted individuals. And, the one advantage that I really see, well, there's many advantages, but a big advantage that I do see to a pharmacist is oftentimes people have relationships with the pharmacist for another reason. Maybe they have, other health issues and they're going for their medications on a more regular basis. And that can make a big difference. It also makes a big difference that, you're going to somebody that, has an education, that is able to answer questions and that is able to spend some time with people in answering questions. So some of the things that we're seeing is that with many of the vaccine clinics, it's just almost an assembly line, like in and out, without any opportunity to really, address the questions or concerns that people have. And that's just one of the biggest tragedies. What I see is a real missed opportunity to be able to have those further conversations or connections after that clinic is over. For many people, they're maybe coming in for a second dose, but that's it. With pharmacy, there's a greater likelihood that that person is going to be coming back, and that's a big benefit. The other big benefit, and one that we can't underestimate, is the proximity. to where people live. So, not having to go, miles or, find transportation that often is inconvenient. What we see is that pharmacies are often located in places where people can access and can get to.
Absolutely, and this is also, it's also important to say that pharmacy should work within a wider health team, including community health workers, to really reach everybody, all vulnerable communities. And we recognize as well the role of pharmacy in empowering caregivers, whether they are health workers or even women or any sort of caregiver, to widen access to vaccination. So I have a couple of things I want to ask you, but first maybe delving deeper into this and maybe asking you more specifically, you're based in the US. So what is the situation there in terms of how is pharmacy supporting vaccinations access, and how can that help?
So the model of how pharmacies have supported access is actually shifting in the US, and it's been great to watch. And there's a lot of really good things, but there's things that still need to improve. But overall, one of the things that's happening in pharmacies is we're finding that, it's much easier to access and get an appointment and really get in to get the population, to get to the populations. Oftentimes, the clinics are only certain hours, where a pharmacy would be open on weekends and evenings, and that can make a very, very big difference. The other thing that I want to highlight, and this is the trend that we are finding very beneficial, and that's the pharmacy as a partner with other trusted community members. So an example would be, I'm part of the Vaccine Equity Task Force in Maryland, and one of the things that we've done is we've reached out to churches in some of the lowest coverage neighborhoods. So in other words, there's very few people that are going and getting vaccines, and it's for a variety of different reasons. Access is one. Oftentimes, you're in an area that's a desert and doesn't have access to good health care, or if they do, they maybe don't trust the health care that's provided them or that have been mistreated. And so one of the things that's happening is that we're reaching out to the community churches there to hold vaccine clinics, because they know their community, they know how to get people out, they know how to talk to people, and then they're partnering with pharmacies. So a pharmacist will come and put on a clinic, and and they have trust that they're going to be back and take care of things over a period of time. And that's one of the things that we're seeing, is that bringing vaccination closer to the community can mean a lot of good things. The other thing is, oftentimes, the pharmacist may be familiar with the community or look like people in the community, and that can make a big difference in promoting trust. So some of the things that we've also found is that one of the things that we're facing, and this is something that sometimes happens, in particular when you go in the store, in the pharmacy itself, is that there's often a lot of paperwork that needs to be filled out, and people, for various reasons, and there are a variety of reasons. Sometimes it's the print, as simple as the print is too small. So if you've seen, I'm sure you have, some of the forms that you have to fill out, I have trouble in filling those out. So, you can imagine somebody that maybe, hasn't taken care of their eyes, or, has, just struggles to see that might be a big thing. And knowing that there's going to be people there to help you fill things out can make a big difference. The other thing that often happens, and that we've spent a lot of time in Baltimore City thinking about, is doing disability assessments and informing people about, well, are there going to be physical barriers? Are there going to be people there that can help you, navigate or fill out forms? Can we address, even though this isn't a disability issue, but can we address language concerns, which become a real consideration? And that partnership of community with the pharmacy and with the health department going forward to address all of the needs of a person and make it easier can make a big difference. And what we're starting to see is that people that weren't going in previously are starting to go in because they're building more trust. And then the value is that, again, those conversations happen, and it's just not about the person that's being vaccinated that day, but again, it's also another opportunity to ask about, do you know of others that may be needed as well, needed to get vaccinated as well.
Absolutely, and we've touched on it. Health literacy has to go hand in hand with any discussion on access to vaccinations, and there are a lot of reasons, as you mentioned. It's actually one of this program's events focuses on health literacy as well as vaccine hesitancy, and it's really great to hear that your work involves working with faith leaders, because we do know how these groups have impact, and I think we need to reach out to as many stakeholders and leaders as possible to improve that issue. I think that's really, really great. Can I ask you one more question on health literacy? I know it's not exactly LifeCourse, but again, linking that to pharmacy, what are your thoughts on how pharmacy can reduce health illiteracy, I guess, and what more would you like to see?
That's, again, a great question, and I think an important question. And what I'd really like to see is something that we're starting to work on before, and that's more of a recognition that people have different needs at different stages in their lives. They also have different needs or different ways of taking in communication or processing communication based on, their own, lived experience. And oftentimes when we communicate in a very generic way. And I think what's really important is that co-creation exercise, to be able to recognize what are the needs and what are the concerns in the community, and talking to people in the community about, what questions do they want answered? What do they want to see? Because oftentimes what we see is communication about, this disease is very serious, you need to get your vaccine, don't worry about the side effects or things like that. And that could be very dissatisfying to certain people in their communities. An example would be, for example, like older people that, again, going back to the situation in Baltimore, we have very poor African-American communities that tend to have higher rates of diabetes and heart disease and all sorts of things. So many of the questions stem from situations like that. Is it okay to get the vaccine with my medications, and being upfront? And when we brought in people, from the older adult group in those communities, they told us, what the conversation looked like, what they wanted to hear about first. What are the things that would help put them at ease? So things like knowing, can I take this with my medication? What are you going to do with all of the data that you're collecting? And, knowing that and communicating in a way that addresses the things that are their concerns can help build trust. And so that's, one of the important things that we think in developing communication, that you should think about, again, what are the priorities? Because for many people, and this, seems unusual, but it's actually not about COVID for them. It's about, surviving. It's about, how am I going to take care of my family, or how am I going to get to work? And I'm worried about the side effects. And yes, you're telling me the vaccine, will prevent this terrible, tragic event of going to the hospital, or even worse, dying. But what about, it's a big deal for me if I miss a couple of days of work and my employer is not able to, give me time off, what happens then? And working through some of those questions and communicating the stories of what's happening in the population and how people have gotten past that can be a big benefit. And that's a role that a pharmacy can play, because in the process of talking to people, you have some examples. Now, of course, there's always privacy concerns. So, you can't share things without people's permission, but you can share things generally, and you can talk about, I just talked to, another woman that had a very similar experience. And that makes all the difference in the world in making sure that people listen first, and then you can provide some of the information that they're most interested in.
Thank you, Lois, for that very really helpful, specific recommendations for pharmacy. And I know our audience here, especially pharmacists who will be listening to us afterwards, will be really find those resonating with them. I have one last question with you, Lois, and I'm very happy to talk to you more. But I do know there's a lot. We can never stop talking if we were, especially when it comes to this. But one more question for you, and I know we'll continue discussions later, which is about what what are the biggest lessons from COVID-19 when it comes to vaccine equity, and how can we be better prepared for future pandemics?
Yeah, and I think that that's an important, really important question. And I think many groups need extra attention in their own strategies. And so being prepared to talk to people in the community, to not just assume that we know what's important. I think oftentimes, from a communication standpoint, we're often doing just focus groups, and you don't quite get down to the issues that are really on people's mind, because it's so specific about that disease. And what I said earlier about, for some people, it's not about COVID. It's about other things, and really understanding that context of lived experience and, what some of their challenges are really, really crucial. So, treating people, bringing them in and hearing what they have to say, I think is important. So understanding your community. The other thing that I would say is that bad news travels fast, and it travels a lot faster than good news. And things like distrust really become very prevalent during a time of a pandemic. And we need to, counter that real desire to tell people that they're being silly, or that their concerns are unfounded. And we need to really listen and engage people and use trusted messengers out there. So they're sharing stories of success and sharing how people changed their minds over time and what the best practices are in communication. Because I think a lot of this is all about communication and understanding, how do you adjust your communication based on, the person that is in front of you. And communication should be co-created. It's for many people, it's not about ads, but about real people in the community that are educated and sharing experiences. We've used ambassadors in our community, spent a lot of time educating them and making sure that they can go out and just talk to people and share experiences. And in a sense, a pharmacist is also an ambassador, you know, for the community, and trained to have the conversations with people that are respectful, that are getting at, you know, what are the other concerns that you have besides the disease at hand, can be really important. And there's opportunities to take those experiences and know how to address them, because oftentimes there's many services in a community. So a pharmacy is not going to be able to help with, you know, food or housing or, you know, employment concerns, but oftentimes the city or a state or whatever government is available has services and doesn't know that these are available. So even becoming informed about where do you direct people is a really, really important thing to be able to do. So, you know, just have a list of various city services and be prepared to be able to help people out, because again, this only helps build trust in the public health system. So we've got a long way to go in addressing distrust, and we really need to remain consistent and hear what people are saying. So knowing again that we can't address everything, but it is an opportunity to address the needs of people that have been marginalized in some way. And we really do need to treat this as an opportunity to address public health and help improve public health and bring people in so they feel comfortable asking questions and we're able to provide accurate information.
That's a great take-home messages. And I've noted lots of things we can do. Thank you, Lois, for the lessons from you. And I think I'm going home with the thought that inequities are cumulative, and we have to keep that in mind when we look at LifeCourse approaches. And of course, you said a lot of things about policy changes, using data, using the services we have, and making sure that policy change focuses on removing existing barriers as a first step. And I really, really agree. And from our point of view at Pharmacy, see how we can utilize our roles within the healthcare system and team to address some of these issues. Thank you so much, Lois. This has been such a pleasure, and we are really, really, really honored to have you.
It's been a pleasure talking to you as well, and wish you all best of luck, and thanks for the opportunity.
Thank you.